Good afternoon and welcome to the city's Mental Health Community Forum. My name is Dee Dee Kavanaugh and I'm the Mayor Pro Tem for the City of Simi Valley. Before we get started at today's event, I would like to recognize our partner agencies that have graciously volunteered their time today to speak about the mental health services that are available to our community members. A sincere thank you goes out to Adventist Health Simi Valley, Simi Valley Kaiser Behavioral Health, Ventura County Behavioral Health, Ventura County District Attorney's Office, the National Alliance for Mental Illness, the Free Clinic, and Clinicas del Camino Real. Special thanks goes to Ventura County Supervisor District 4, Bob Huber, who supported our efforts to today's event and the City Council's desire to put together a community forum to make our residents aware of how they can access mental health services for themselves and or a loved one. Supervisor Huber, is there anything that you would like to add or share with our panelists today?
Oh, thank you. Yes, I'm so pleased to be part of today's forum. Addressing our community's mental and behavioral health needs is one of my top priorities. As we all know, it is complex and a difficult job for families and professionals, even more during a pandemic. It is my hope that one day mental and behavioral health issues can be commonplace and robust as our medical services for physical health. We are fortunate to live here in the city of Simi Valley and the county of Ventura. We have some of the finest public employees that are diligent and do very good work. Best of all, together with our public employees, community members, and elected representatives, we join and strive to improve. That is why we have our forum today. I also want to let you know about a few representatives that serve on our County Behavioral Health Advisory Board, or commonly known as BHAB. From the 4th District, we have Jerry Harris, Jennifer Morrison, Jesse Finkbeiner, and Krista Hada. These are representatives you can reach out to should you have questions about mental health services for you, your family members, or friends. I want to thank the City of Simi Valley once again for allowing me to be part of today's forum. I want to thank you, the members of the community, for caring about mental health and joining us. And I look forward to listening to our speakers. Thank you.
Thank you, Supervisor Huber, and we appreciate all of your support. So I'd like to take a moment to share with the group that this forum is being recorded. We will be posting this on the city's website and also utilizing our social media platforms to encourage those who could not attend to view the recording. A question and answer session is allotted after our speakers have concluded their presentations. Should you have a question, please submit your question in the chat box and we will address it after all of our speakers have presented. If you have a question for a specific presenter, please identify them so we can direct the question accordingly. As a courtesy to all of our speakers, please utilize your mute buttons if you are not speaking. At this time, I'd like to hand it over to our Assistant City Manager, Linda Swan. Thank you, Linda.
Oh, thank you, Mayor Pro Tem Kavanaugh. Before we get started, just a reminder that we have a full itinerary and we ask panelists to adhere to their allotted time for presentations in order to get through the whole agenda. And with that, I'd like to introduce our first speaker, Jennifer Swenson, President of Adventist Health Simi Valley.
Thank you, Linda. It's a privilege to be here and talk about the services that our local hospital offers. As Linda said, my name is Jennifer Swenson. I'm the president here at Adventist Health Simi Valley. I've been here for about 7 years, and our services have changed over the course of time if you've lived in our community. We actually used to have a psych hospital located off of Erringer and Los Angeles Avenue, but that was closed in the early 2000s due to lack of funding, honestly, for behavioral health programs. And so what we offer currently at the hospital is more of a crisis time for intervention. So as either our police force, our sheriffs, a local community member, if they're having a mental health, what I'll call a breakdown, they can access our emergency department either through ambulance or walk-in. And once they're in our emergency department, they will be provided a full assessment. And then that assessment will dictate whether they need to be placed on what we call a 5150 hold, which is really meant to keep our patients safe. And when we do that, we work very closely with our Ventura County Behavioral Health Program and our crisis team. The crisis team will be initiated at that point. They come out, they do an assessment on our patient and whether they require an inpatient stay or it can be handled on an outpatient basis. We do have several community providers that are located in and around Simi Valley, Moore Park, Thousand Oaks area. And we do have a psychiatrist that's on call 24/7 for those patients. However, we do not have inpatient beds. And so what that means is when a patient requires an inpatient stay, we'll work with our county team and they will help us get placement either in county or out of county. The challenge for us is the lack of beds that we have in our community. And so for Simi Valley, we tend to place the majority of our patients outside of Ventura County. So I think Ventura County Behavioral Health might update us today on the status of what they're doing to increase capacity for our community, because the need has definitely outgrown the beds that we have today. So that gives you a perspective of what we have at Adventist Health Simi Valley. So once again, it's more of a crisis intervention versus any inpatient beds, as we do not have those. One program that we did start, though, that really crosses into the behavioral health space is substance abuse. We did start a substance abuse navigator program. The individual is here Monday through Friday from 8 to 5. And they work very closely with our clinical team. If somebody has a substance abuse issue, they will work with them on an outpatient basis. And we've actually placed those patients in substance abuse programs, both in county and out of county. And that program is accessible to our community. And what I'll do is I'll put in the chat box the number to access our navigator. And we're seeing some real benefit to that program. And unfortunately, we have many patients who are seeking access to that program. So we've seen a spike in our substance abuse over the last couple years. So that, I think, gives a summary of what we offer. Thank you, Linda.
Thank you, Jennifer. I'd like to introduce Rachel Yazujian, Clinical Program Manager from Kaiser Behavioral Health. Welcome.
Thank you, Linda. You pronounced it exactly right. My name is Rachel Yazujian. I am here on behalf of Kaiser, and I'm going to be talking about our Simi location. I am the manager here over this location, but we do have other clinics in our service area, so I will give a brief rundown of those as well. So I do have a little PowerPoint just that I'm going to share right now. Okay. So if you're not familiar with our location, it's a new facility. We have been here for almost 3 years. We're located off of Tapo Canyon and Alamo. So we're right next to the courthouse and conveniently located between the DMV and the police station. So that's where you can find us. We do have another Kaiser across the street. That is for family medicine. So not to be confused with that location. We provide mental health services here on an outpatient basis. And we are working with patients under psychiatry, but also addiction services. So the people that we're serving are all ages. Here is our address you can see on the screen and the number for our appointment line. So if you are new to Kaiser and you are needing to get services in the behavioral health department, you will call this 855 number. It's 855-701-7955. So this is how you will go about requesting an intake. So that's the first step to get you in the front door. We will conduct a thorough assessment and then go from there. The other number that you're seeing on the screen is for after hours when our call center is closed. So if you need something, if there's a behavioral health emergency, you can go ahead and call our after hours number. And that is the 800 number, 800-900-3277. This is a picture of our location. So the services that we offer here, as I mentioned, we are doing psychiatry and addiction services. Some of our Kaiser buildings have them separate. So you'll have just a psychiatry building and then just an addiction medicine building. That is not how we are at our Simi location. We offer all of the services in the same building. Kids and adults, everyone, we're all seeing under the same roof. So the services that we're providing for outpatient are individual, family therapy, couples, case management. We also have higher level of care options. So here in our clinic, we offer intensive outpatient services. That will be 3 days a week. We have group and it's 3 hours each. So totaling 9 hours. We have one for psychiatry and we also have one for addiction. Now, these are for adults, but we also do have the ability to work with our contracted providers if we have someone under 18 who is needing a higher level of care also. Some of the other things that we have here, we have intensive case management. So we have a BIOS program, behavioral health intensive outpatient services, and those might be for the members who need a higher intensity treatment. And so we manage those, we follow them, the cases, and provide case management very closely. We also have crisis services available. So we have a therapist who is available for walk-ins and crisis appointments daily. So that is another option that we have here. The services that we're providing, we also have groups, a number of groups in addition to the outpatient intensive. We have a lot of DBT groups. We have groups for teens. We have groups for people struggling with addiction issues. Prior to the pandemic, most of our services were offered face-to-face. And now, going through the pandemic the last 18 months, we've really modified the way that we're providing care. It can be in person, it can also be telehealth, so we can do video sessions and we can also do phone. At this moment, all of our groups are virtual, and eventually once things are safe to do so, we're going to go ahead and bring people back to do in person again. We also have referrals to outside community resources that we make available. So what we're doing here after the intake when you come in is we're working with each member to develop a treatment plan that's best for them. So it's going to be individualized. It's going to look different for each person depending on what their unique needs are. And we are goal-oriented in treatment. So let's see. So pandemic challenges, as I've already mentioned, I'm sure a lot of people are dealing with this. We've really seen an increased acuity. So not only do we have an increased acuity, but there's a higher demand for services and the resources have remained the same. So that is the one situation that we're dealing with right now. And as I've already mentioned, we've expanded our sessions, our availability to virtual, which is we've been able to serve a wide range of people through the pandemic. So lastly, I just want to go over the other clinics we have in our service area. So the Woodland Hills service area is made up of 5 clinics. Simi Valley is one of them. We also have 2 other clinics in the Ventura County area. They also are all ages, and psychiatry and addiction services are provided there on an outpatient basis. So one of them is in Thousand Oaks on Houghton Camp, and then the other one is in Ventura on Hill Road. So the other 2 we have are actually in Los Angeles County, and that is still covered under our Woodland Hills service area. So we have a location off of Irwin Street in Woodland Hills. That is for adults only, and it's only psychiatry. We don't see addiction patients in that facility. And then the other one that we have is at our main campus in Woodland Hills off of DeSoto, and that is our CAP program. So it's Child Adolescent Psychiatry Program, and that is 18 years and under. So that concludes my PowerPoint, and that is all I have for Kaiser.
Thank you, Rachel. All right, let's welcome Dr. Savette Johnson, Director of Ventura County Behavioral Health, and Mike Pettit, Assistant County Executive Officer. And I know they're here. There you are.
I was waiting for Mr. Pettit to see if he was going to have opening remarks.
No, thank you, Dr. Johnson. Thank you to the city of Simi Valley for making this forum possible. We're just so appreciative of the community support with many services. Our fellow advocates from Nami and the free clinic and the many services that are available. We're excited to share this information with you today. So appreciate that opportunity. And I'll turn it over for the real expert here, and that's Dr. Savette Johnson.
Thank you so much, Mr. Pettit. And thank you, Ms. Swan, for the invitation. Thank you to Supervisor Huber for having the vision for this and wanting to bring this information to your community. I'm honored to be on this panel with such esteemed colleagues who are doing this great work of serving our community. So I, like Rachel, have a PowerPoint that I'm going to share, and I'm going to preface it with, I will be a little bit longer just because there's a great deal of information that I want to cover to make sure that people know what the county offers and sort of what our mandate is, right? So we're going to go over an overview. So our mental health plan mandate, as mandated by the state, is that we are to provide or arrange and pay for medically necessary covered specialty mental health services to Medi-Cal beneficiaries with serious mental illness. And that's the wording from the state. Just want to be very clear, that's the wording that they use in our contract. So what this means is that the county is the safety net, meaning that we do not deny coverage or turn anyone away, regardless of insurance status or ability to pay. If someone shows up and says, I need help, we are going to assist first. We'll try to get financials later. And if someone is unable to pay, we will do our best to help them enroll with Medi-Cal. We are on the level of acuity at the highest acuity. We serve the highest acuity in the county. So we serve moderate to severe. And that's our carve out because we are a specialty mental health plan. So that's also something to note. Mild to moderate usually goes to community-based organizations, and moderate to severe comes to the county mental health plan, which we are. These are just some of the services that we offer. It is not the whole detailed list, but of course, mental health services in the form of individual therapy, group therapy, family therapy, medication support services. So that could be meeting with a psychiatrist to determine if someone might benefit from psychotropic medication, or even talking to someone to say, I understand I benefit, but I'm not ready for that yet. And what are some other things that I might be able to do to see if I can manage the mental health concerns that I have. Many of the adults that we serve are on medication support services, but of course with youth and family, that's never the first resort. We usually look at behavior and how can we modify either the environment instead of dealing with psychotropics, but we do use that at times when it's needed. We provide day treatment intensive services, day rehabilitation, crisis intervention. We've heard a lot about crisis intervention today. We do have a 24-hour, 7-day-a-week crisis team that is available to anyone in the county. If you have insurance, if you don't have insurance, if someone is visiting at your home and is having a psychiatric crisis, you can call the crisis team, and the crisis team will do a screening over the phone to determine if a field response is needed. And if so, they will go. If it's determined that there is a weapon in the home or something that makes it unsafe for our staff to go out, we will engage law enforcement to co-respond with us. Also have crisis stabilization in the form of a crisis stabilization unit. That is an 8-chair facility. And it's a 23-hour and 59-minute facility, meaning that someone may go there, but they typically do not stay more than 24 hours. It's really to hopefully avoid hospitalization and allow them to return to their community. But at times it is needed for someone to go to and be admitted to a psychiatric hospital. So of course, we also have a psychiatric health facility. It's called the Inpatient Psychiatric Unit. And again, that is a facility that is in Ventura, but of course, people from all over the county do funnel to that point. As Ms. Swenson talked about, sometimes there are not enough beds. And so we do have to go outside of the county to navigate and find a bed. We also do partner with Vista Del Mar, so that's an in-county option when a psychiatric bed is needed if the county hospital is full. We also have crisis residential treatment services. So that's short term, but not as short term as just 24 hours. Usually someone can stay there for up to 30 days. And we have some developments on the horizon there. So, and I'll talk about some of the additions to our system that are coming pretty soon, and it's very exciting. And we also have therapeutic behavioral services and intensive home-based services and coordination. And that's usually for our youth and family clients when there's an environment in the home that is not conducive. And we really want some on the spot, in the moment interventions that can help that child and the family. So this is one of my favorite slides. It's a pyramid of our services, and it really gives you a snapshot of what we do. And if you start at the base, we talk about prevention, outreach, and education. And this is universal access. So anyone can engage in these services. They're natural community supports. So our prevention program, our mental health prevention program in fiscal year 1920 served over 176,000 people. And our substance use disorder prevention program served almost 275,000 people. So those are our big impact programs that really stretch far and wide. And it's really about, if you think of it like a public health angle of wanting to educate and inform our community across the board so that people never even enter our system. We have outreach teams such as RISE and the Grando Bienestar, and you can see RISE, reached out to over 1,400 clients that year, and the Grando Bienestar connected, over 700 to services. Next, we have screening and assessment. And this is where if someone calls in our 24-hour access line and says, I need help, or if an ambulatory care clinic sends a referral over because a practitioner is serving someone and they're concerned that maybe there's something else going on. You can call that number, you can be screened. It's about a 10-minute screening. They'll ask you some basic questions just to get an idea of what's going on and what's causing you concern. And then they'll let you know if maybe you need to be scheduled for a follow-up for a fuller assessment to really understand some of the different variables that may be affecting you and determine what level of care you might need, whether that's through the county and it's for moderate to severe symptoms, or if maybe it's a community-based organization that could better serve your needs. You can see we did about 3,800 assessments in that year. That's a lot for mental health and almost 1,400 for substance use. Next, we have peer family systems and support. Nami, a huge partner. Nami has been around for many, many years here in Ventura County and works with families. And that's extremely important because we know that mental health and wellness does not just impact one person who may have a psychiatric diagnosis, but it impacts the whole cell system around them. So NAMI offers many amazing classes to educate families about mental wellness and to offer support for navigating different systems. We also have wellness centers. And wellness centers can be very helpful for the population that we serve because oftentimes many of the clients we serve, they don't have a typical 8-to-5 job. Often they are impacted, and so they may not work, or if they work, it may be a few hours a week. And we really want to encourage folks to get up, to get dressed, to have some sense of structure and normalcy, to be connecting with others outside of their living situation. And the wellness centers are a perfect solution for that. They can go there and take classes, cooking classes, do yoga, do exercise, and learn about independent living skills. So there is one in East County that folks can attend. Then we go down to outpatient services. So that's the individual and group therapy, wraparound intensive, our full service partnerships where people can be seen several times a week as needed, where if someone has a medical appointment or a dental appointment, they're going to have a case manager that will help them navigate, drive them there often, and really be their point of connection for the different services they need in order to thrive and just to really be healthy. Then we have residential services and our hospitalizations. Of course, we talked about, we have boarding cares across the county. We have Horizon View, which is a mental health rehabilitative facility. It's 16 beds at Camarillo Airport. We have Telecare Camarillo, where folks from all over the county can go and live for residential care and mental health supports at 60 beds there. And folks can only stay there for 18 months. So it gives other people the opportunity to go get those skills, get that treatment, and then be reintroduced back to the community. And then we have Hillmont House, which is 15 beds as well. Same theory. For substance use disorder, we have 194 residential withdrawal management level of care beds. And that's extremely important because often if someone comes with a substance use disorder and they're saying, I want to get help, I really want to be sober, they are going to go to a withdrawal management, otherwise known as detox, for about 30 days. And then they're going to be released. And when they're released, if they go back into the same environment they were in, statistics have shown us that that's usually not very healthy. And they usually need some time to adjust back to being out on their own, living in the community, and learning healthy habits to remain sober. And so those beds are extremely important. They are all across the county. To help individuals get on the right foot after they have gone through withdrawal management to stay sober. And then lastly, our crisis continuum. We've talked about our crisis stabilization unit. We have a youth crisis stabilization unit that's 4 beds, and our crisis line that fields almost 30,000 calls in a year, and that's pretty average. As some folks have mentioned, before COVID, most of our services were typically only in person. But COVID brought us telehealth pretty much overnight. All of our clinics remained open. We never closed. However, now we continue to offer a virtual option for folks who may not be comfortable coming into the clinics. And we do have some folks who may not be comfortable. We do have groups. We offer them, of course, in person and virtually, because again, some folks are not comfortable being in a group forum with others, and we want to respect that. So year over year, we serve about 15,000 unduplicated clients and a variety of forums, and you can see the racial breakdown as well as the breakdown of the percentages we serve in each area. You'll see in Simi Valley, we serve about 11% of folks in Simi Valley out of the whole county. And just so you can see some of the diagnoses that we serve, the primary ones are depression and psychosis, with our minors primary being depression and trauma. So accessing services, we have a no wrong door philosophy. So we have a STAR program. It stands for Screening, Triage, Assessment, and Referral. It's a centralized point of access, and those phones are answered 24 hours a day, 7 days a week. That's our access line. So someone calls, they can get information about mental health or substance use services. They can schedule an appointment if need be, or be screened in the moment. We have regional clinics that clients can walk into, and they can get an expedited appointment with STAR if needed. And we have contracted providers that are embedded in the community, and they also provide assessments and services. So we have a lot of access points that one can go to. And this is just a little visual we put together showing all the different access points. Someone can come to us from a crisis, a follow-up to a crisis call, or having been hospitalized, or visiting the crisis stabilization unit. Someone can self-refer, or maybe the community, meaning a school, because we're also in the schools, or a community health clinic can refer someone for services. And going out, we often refer to Beacon or lower levels of care, or community-based organizations. If they don't fit into the bucket of Beacon or community-based organizations, then that means they're a prime candidate for our services. And depending on their age, they either go to the youth and family division or adults. Depending on the intensity and the needs that are determined, they'll either go to a regular clinic or a full service partnership that provides more intensive services. And of course, the bridge to crisis and residential services is always there as need be. As we know, mental health and wellness is fluid and dynamic. So we make it pretty easy to go back and forth depending on where someone's at. For adult services, who do we serve? Adults 18 to 25 with a serious mental illness or significant functional impairments. You'll see the breakdown for transitional age youth, it's 18 to 25, adults 26 to 60, and older adults are classified as 60 plus. Most of our treatment is voluntary, and half of our adult clients have been with us less than 2 years. And we really have that philosophy of whatever it takes. And you'll see that it's case management, psychotherapy, rehabilitative services, crisis intervention, treatment planning, medication support. And that all gets rolled up in an assessment and treatment plan to say, this is what we think is going to work. What do you want to do? How do you want to address this? How can we help you to be healthy? And it needs to be client driven, because often if you don't have the buy-in of the individual you're serving, it's going to be very hard to meet your goals. Sometimes we do have that buy-in and oftentimes we don't. And I think no matter what scenario we're in, we aim to make it work. We do have about 164 adult clients on a full conservatorship, meaning that for whatever reason, their symptoms, their diagnoses is acute enough that they do need another individual to make some of their financial and medical decisions for them to ensure that they're treated. And currently there are about 44 who are in locked facilities. And that's really for their health and well-being. Our adult clinics, we have 6 regional outpatient clinics. We absolutely have one in Simi Valley. We have services to the jails and justice involved, residential, crisis response and stabilization, and of course our inpatient psych. And we have specialized services and programs above and beyond just our regular outpatient clinics that are available countywide. So we have our assertive community treatment, which is called Vista Voice. Our treatment for early psychosis. So this is usually populations from 15, 16 to 25, and that's called VC POP. It really targets looking at early psychosis in individuals who may be displaying signs early, because research has shown us that the earlier you can catch psychosis and treat it, the better the trajectory of that illness will be. So there will be less intense symptoms and less intense episodes. And so we definitely want to work to catch that as early as possible. We have our older adults program, which is really amazing, especially during COVID. Our older adults, as many of you know, living through this, were a population that really early on were sort of told to stay at home and don't go anywhere. And many of our older adults, they hadn't seen family, they hadn't seen friends. And so we were able to safely and with PPE make sure that staff went out to see them. Their psychiatrists did home visits. We did telehealth for those who had devices and were able to acquire iPads for those who didn't, to really make sure that we stayed in touch with our older adults and that they were served and got the care that they needed. We also partnered with the Ventura County area on aging to deliver meals to our older adults. And they did an amazing job with that program during this time of COVID when there was a lot of food insecurity. We have our EPICS specialized program. These are some of our highest acuity clients, and some are here in the county and some are in locked places outside of the county, but we make sure we touch base with all those clients on a regular basis, either in person or touching base with their families or the facilities that they're at to ensure that we're providing case management as needed. We have PATH, which is services for individuals who are homeless or at risk of being homeless, which is extremely important. As we all know, if someone is not safe and secure, it's very hard to focus on your mental health when you're worrying about where you're going to sleep tonight. So that is a very vital program of making sure we're helping individuals to enter into the online portal for housing, and so that they can come up and when they're eligible and be considered for housing as it comes up. We talked about our transitional age youth program. It's just a different population. They're not quite adults and they're not kids anymore. So it does require a different kind of service, a different kind of approach to engage with youth of this age. They're really going through that separation from parents. And so often there's a great deal of rebellion. I can do it on my own and I'm a grown up, but still needing some help to navigate life and to work on the illness that they may be struggling with. So that's an extremely important program. And of course, ASSIST, which is Laura's Law, is Assistant Outpatient Treatment. This program is critical because for some individuals who may not believe that they need assistance or may not really want assistance, it's really helping them see how we can serve them. So it's building a lot of relationship, or what we call rapport, and giving them time, getting to know them getting to know us, trust us, and just really being consistent and coming back time and time again to be able to enroll them in our services to get them the help that they need. We have a lot of value partnerships. These are a few of the critical ones: Telecare Corporation, Turning Point, PathPoint, and Golden State, but there are many, many more. In adults, we classify things by acuity, and that's how we really determine how do we engage our clients? What does a treatment plan look like? What is the standard of care, right? Because standard of care is extremely important. So individuals who may be classified as high acuity, they need to have staff with lower client caseloads so that they can have more frequent contacts. We need to make sure that they are, complying with their living arrangement, taking their medication, and doing all those things. For someone who's more moderate or low, they may just need to take medication and have check-ins every once in a while, where other folks who maybe try trading down off medication or not requiring it at such a high doses, the question would be, do they still require specialty mental health services, or are they appropriate to transfer to a lower level of care? So when we say someone has high acuity, that's because they've had some recent psychiatric hospitalizations, and they have a diagnosis that would warrant some oversight by our clinical staff. And someone with a lower acuity, they likely haven't had contact with the crisis system for some years, and we have a tool that we use to help us understand how they're functioning with family, with friends, if they're volunteering, so really how they're doing in their community settings, which is really helpful. So when we think about our approach, it's client-centered. It's got to be diverse because we serve a really diverse client population: age, rate, sex, socioeconomic status. And so we have different levels of placements and care. We have different specialties, some in-house, some that we contract out, and we have different size clinics, locations, and cities. And so it really makes up this huge network that we have for placements. And you can see here, it's just a snapshot of our locked and unlocked placements, boarding cares, and then we have residential care for the elderly and skilled nursing facilities for some folks who may need additional supports because of medical conditions that may be ongoing. And of course, our various out-of-county placements. So you can sort of see what we look like when we are accessing our full network for housing options. And of course, we have our contractor providers for our mental health rehabilitation centers, adult residential care facilities, adult crisis residential treatment center, and our teen adult wellness centers. So it takes a village truly to provide this level of services. So we have some things coming up on the horizon that Jennifer referred to. We're most excited about a 120 bed locked facility that we look to bring in the next 3 to 5 years. And that will be a great help when we talk about beds and needing beds in our community. It will not only lift the flow and the throughput for our current county hospital, our IPU, where we can make sure we're using all those beds for the truly acute, but it also allows us to look at the folks that are placed out of county currently and bring them back home so that they can be closer to their family and can really engage with their family in therapy and just in social interactions here in the county. There is a 15-bed crisis residential treatment facility that's going to be opening in the fall of this year. Now that will be in Santa Paula. We're able to retain 60 beds for a boarding care that was shutting down. And we were able to really work with them to not repurpose that for something else, but leave it as a boarding care so that we would not have people that would be facing homelessness. And we were awarded a grant through Gold Coast to add some positions to provide linkage to services after someone is discharged from the hospital. I know that since, I want to say 2019, it started before COVID, we were working with a developer to bring a CSU to East County, and they actually, I believe, met by phone with Supervisor Huber and some of his staff. And then COVID happened and some of the markets changed. And so we are hopeful that after the CRT opens this fall and they see that we can keep the facility full and that we have people that are going to be using that service, that they will be open to talking again about bringing a CSU to our county. But in spite of that, I know Supervisor Huber and Supervisor Parks have been very focused on bringing a CSU to East County. And so that is something that the healthcare agency is actively working on. We've been looking for property since earlier last year, and we're not able to secure a site. So now we're looking at county property and what can be repurposed in order to fit the need for a CSU in East County, knowing the need is there. So for our youth and family division and who we serve, youth ages 0 to 21. Our largest group is our Medi-Cal recipients, and they meet medical necessity, meaning that they have a mental health diagnosis, significant functional impairment or probability of impairment developing, and it cannot be addressed with physical medicine. So you'll see that the criteria is much more broad for youth and family. And we serve youth through contracts, through our staff, and through collaborations with Ventura County Office of Education and SELPA, the Human Services Agency, Juvenile Justice Center, and CalWorks. And again, they provide just about all the services that adults do: assessment, referral, individual, family, and group, intensive care coordination, behavioral services, medication administration and monitoring, crisis intervention, and teaming, which is meeting with the child's whole team, not just their clinical team, but if they have medical providers in their schools or social workers, everyone is at the table. These are just the venues that we serve youth. We're in over 130 schools throughout the county. We're co-located in job and career centers. We provide, of course, telehealth, the Children's CSU we talked about. Services are provided by Behavioral Health and the Juvenile Justice Center, home and field-based, and STRDP short-term residential treatment programs. Again, just a list of all the partners that we work with to make this happen. Would be absolutely impossible to do this work without them. For substance use, we became a drug Medi-Cal organized delivery system in December of 2018. And what that means, it's a long title, and it just means that we're able to provide substance use services for individuals and bill Medi-Cal. It is now a Medi-Cal benefit. So because we entered into this pilot, it allows our community to have a strong continuum of care. You can see we go from early intervention to outpatient to intensive outpatient, residential, and medically managed intensive inpatient services. We have that 24/7 substance use disorder access line. We have withdrawal management, otherwise known as detox, care coordination, recovery services, medication assistant treatment, the whole gamut. Primary population are Medi-Cal beneficiaries, adult and adolescents. Of course, they have to meet that medical necessity criteria. And we have multiple community-based prevention initiatives. And so that's really important. It's getting to the community, it's hearing from the community, and really trying to target what we see happening in our community to be successful in those areas. So again, they do screening, determine medical necessity, individual group counseling, family therapy, crisis intervention, just about the same things that on the mental health side. They have our substance use block grant. They have 5 key initiatives: prescription drugs and heroin, targeting youth marijuana in their prevention campaign, targeting impaired driving, targeting health disparities, and underage drinking prevention. So those are some of the major campaigns. I'm sure you've seen some of these posters. I know I see them in my advertisements on the Star and in different things in our community. So I have a few slides from other offices that I want to make sure I get to, because mental health doesn't just stop with the behavioral health department. We have Michael Rodriguez here from our public defender's office, and the public defender's office often intersects with behavioral health to ensure service providers are able to obtain the behavioral health service that is specific to their clients' needs. So in adult criminal justice, they have mental health diversion and mental health court, and they have cases where adults have been declared incompetent to stand trial. And so often what happens is that they need to get treatment so that they can be restored to competency and then go through with trial. So our public defender's office is very active and engaged on that front. There's involuntary psychiatric commitments when there's either serious or violent felonies, and a program placement and transportation. With juveniles, they have juvenile mental health court, and they represent children who've been commercially sexually exploited. It's often referred to as CSEC. And cases where juveniles have been declared incompetent to stand trial as well. I touched on earlier LPS conservatorships. The public defender's office will help with involuntary psychiatric commitments, those hearings, capacity to consent to medications, temporary conservatorship proceedings, and conservatorship trials. And lastly, we have probate conservatorship proceedings. And it's for folks often referred to as dementia that are suffering from dementia. So that's a neurocognitive disorder. And we have limited probate conservatorships for the developmentally challenged, those who are served by Tri-Counties Regional Center. Probation. Most people don't think about mental health when they think about probation, but they do a lot on the mental health and behavioral health front. We actually have staff embedded in the Juvenile Justice Center. Their goal is to promote the recovery and treatment of those who suffer from serious mental illness and are accused of having committed crimes, with the goals of reducing recidivism while ensuring the safety of our community. So intensive community-based treatment and case management, promoting personal accountability, the health and wellness in all areas of the client's life. So again, they touch on mental health diversion as well. And they have probation client-specific services, are core services provided by Interface Children and Family Services. That's a community-based organization. The East County Reporting and Resource Center by GEO Reentry Services. And those programs provide substance abuse treatment, cognitive behavioral training, employment readiness, family therapy, and of course, other life skills training. They also have Insights Court, which primarily serves individuals that are youth that have both substance use and mental health concerns. So also called dual diagnosis or co-occurring. And it's again, collaborative teaming for the health and wellness of those youth. And they also have like the Evening Reporting Center provided by Big Brother and Big Sisters. And they provide after school programming and tutoring, counseling, pro-social activities, arts, mentoring, job search for older ones, and other basic referrals to behavioral health for participation in the STAR and substance use services program. So this is a very good partner. Ms. Hart, who is a division manager, is on this call or Zoom today, but if you have specific questions that you don't want to put in a chat for the Q&A later, this is her contact information, and you can reach out to her. Lastly, we have the Human Services Agency. And so HSA, Human Services Agency, Medi-Cal covers mental health, of course. HSA administers the Medi-Cal eligibility for low-income populations, families with children, seniors, persons with disabilities, pregnant women, and low income with specific diagnoses, as they're listed here: TB, breast cancer, HIV/AIDS. About almost 239,000 individuals in Ventura County currently receive Medi-Cal benefits, with almost 15,000 residing in Simi Valley. So their outpatient Medi-Cal mental health services include mental health evaluation, psychological testing and treatment, development of skills to improve attention, memory, and problem solving, and monitoring of education. And of course, we've already talked about specialty Medi-Cal mental health services. So HSA, Human Services Agency, ensures connectivity to special supports for foster youth. They receive special assessments and have very tight timeframes to make sure that not too long lapses from when they're identified to when they receive treatment assessment. Seniors suffering from the self-neglect and other protective issues are connected to appropriate mental health services. Our veterans experiencing challenges are referred to mental health services provided by the Veterans Administration. Parents with low incomes who need to improve their mental health are offered behavioral health services, and people experiencing homelessness receive counseling and treatment. So you can see that there's a wide array of folks in the county who are available in providing services, even if their department hat isn't behavioral health. Before we leave, I wanted to point to a free universal treatment event. It's conversations about suicide, help, and hopes. September is Suicide Awareness Month. Next week, we are hosting this forum. It's online, it is free. You can go to www.wellnesseveryday.org. Again, www.wellnesseveryday.org to register. We would love to have you there. And I just want to thank you for the time and attention to share the information about what the county, your county of Ventura, offers in terms of behavioral health services. Thank you.
Oh, thank you, Dr. Johnson and Mike. Next on the agenda is Roberta Griego, Director of Operations and Community Outreach and Development for National Alliance for Mental Illness for Ventura County. Gonna have to unmute Roberta.
Sorry about that.
Very good, thank you.
So I want to thank the city of Simi Valley for the invitation to speak about Nami, Ventura County, and certainly want to thank Supervisor Hubert's office for all that he's doing for individuals out in the East County that suffer with mental illness, and bringing this educational seminar forward to you. So I'm going to start off with what is NAMI? Let me just get down there. There you go. So NAMI is the nation's largest grassroots mental health organization dedicated to improving the lives of people affected by mental illness. We provide education, we do advocacy, we do support and awareness. NAMI structure is NAMI organization, or the national organization, is based out of Arlington, Virginia. There's a NAMI California, as a state organization based out of Sacramento. And the NAMI Ventura County is one of 54 affiliates within the state of California. And this year, NAMI Ventura County, as well as all the others, are celebrating our 40th anniversary. I'd like to show you this 2020 impact report. COVID didn't stop all of the volunteers and the staff and the board of directors from providing mental health educational services in Ventura County. We served over 4,203. We've touched their lives during the COVID. We did have to transition very quickly because most of our classes were all in person. And during COVID, we had to quickly convert everything to Zoom. So we still did do quite a bit of work, and actually NAMI is a grassroots organization, like I said. So we have over 94 dedicated volunteers that do all of our class education. They are part of our NAMI advocacy program, our support groups. And so that is how we serve so many in this county. So as you can see, a small staff of 3. I am the Director of Operations, Community Outreach and Development. And then I have our Program Administrator, Chris Novak, who handles not only our Family to Family, which is the core-based program that started NAMI families about what is the first thing that families can do to help other families. And that is actually to start a family support class as well as a support group. And then we have Kimberly Quinn, who's the program coordinator that does 4 key programs that we offer also in Spanish. So what is important about NAMI? First of all, I'd like you all to visit our website at www.namiventura.org. 100% of our programs are all free. We do not charge anyone for attending our classes. We use a peer approach. Like I said, volunteers teaching who have gone through classes themselves, as well as peer education and those type of services. So we always use that peer approach, someone that's already been educated in what they are giving the service for. We offer easy online registration to our programs, and all of our material given and heard from by families is confidential, which are with a great data secured base. And we are now working with Zoom until we could get back into person. So what are the services that we can serve you in your community? And it doesn't mean that you need to come to our facilities to reach our classes. We can come out to your city and offer the classes as well. So for families, we have Family to Family. It's an 8-week course that's taught to educate the families of really all the steps that their loved ones are going through their mental health crisis. Again, we offer a weekly family support group. We offered this class also in Spanish. It's called Familia a Familia. The English version is 8 weeks, but we do plan for a 12-week version for the Spanish version. And we also go and provide a Spanish support group as well. Peers or consumers, as they're called, we offer a peer-to-peer class where the individual is coming out of and has gone through their recovery process through medication and starting to transition out into normal day life. So we offer an 8-week class to help them transition back into their daily routines. And we offer also a NAMI connection group for them. On the adult side, we offer several classes. One is Family and Friends, which is also taught in Spanish, and Community Cares. Community Cares is our new program that is actually a 2-hour seminar on any individual that doesn't know really much about mental illness, that wants the educational process, and it is really a lot about self-care. Self-care is so important to our families to care for those individuals. So we also included that in this Community Cares class as well. For the support and recovery side, we do In Our Own Voice and 3 versions of Ending the Silence in our schools. Ending the Silence is where a individual who has gone through a mental health crisis through their middle school or high school, that they come in and they do a 90-minute presentation to the students to know that they're not alone, or else if they've had some symptoms that they feel that are not normal and things that they should start getting help for. Because our mission as well is to catch everybody early in their young lives or any phase, but catch the problem very early. As we try to educate people, is that if someone is doing like say in their everyday routine, just kind of, it's different. They're being secluded. They might not be taking care of their hygiene as well. They're not really talking to friends. That those type of things should be addressed very quickly. If something goes on more than 2 weeks, please don't ignore it. Because again, mental health is just like any other disease or illness out there, that it can be treated and you can recover in your everyday life with it. So another program we do in the support and education side is a Nami faith-based. We will go out to churches and also do educational seminars out in that arena as well. Then, like I said, in the schools, we do have that Ending the Silence program for the students, but also it's for the teachers, the faculty, and the administration as well, as to what to look for in the signs that could be changing in the students' lives, or and just give them the perspective as well as their own education to look for and help the students get through whatever they need in help. And also we have an Ending the Silence for parents, which is very important that we try to educate the parents as well. I think as we all grew up, we all heard our parents saying, oh, it's something you're going to grow out of. But today you really can't go and ignore anything that's in a young one's life. So we try to educate the parents to see the signs, know what the help can be given to them, and help with their children's recovery. And also we offer on high school campuses called Nami on Campus. We've been asked by the Ventura County Office of Education to come in where 10 high schools throughout the county are having a wellness center come onto their campuses. And so we're trying to promote Nami on campus as well. Then we go on to the provider side, people that work in the field. And we provide a provider education seminar. And so the providers can also get a feel of exactly what we can help them for individuals of families to tell the families about our services as well. But we'll come out to any hospital, any clinic, and do this seminar to the people that work in those facilities. And then there's several programs that are on demand. That's NAMI Basics and NAMI Homefront. NAMI Homefront is a brand new program that's happening for not only the individuals of the loved ones that for our military service men and women. So we have a new program, or NAMI has, that will help and support veterans as well. So like I said, one thing that we're very proud of is to have services that can come out to East County, and especially Simi Valley and Moore Park, that offer both community cares, family and friends in our own voice, and in Spanish, as well as the family to family class. And then we actually go and do outreach and teamwork. We reach diverse communities through individuals, organizations, and businesses ties. So let's say for your business, if you have a business out there and you would like to have some educational services, we can come out and do any of our just 2-hour seminars, a 1 hour. We can fit it out into any employer's type of view, just as a self-care and self-awareness about mental illness. So one thing I want to say before I close is about the NAMI Advocacy program. right now, I think, we can all think about that COVID actually reached all of our lives in some way of mental illness. That is in stress, anxiety, coping, and all the other type of things that go along with that. And so right now, I think we're all recovering, trying to maneuver through COVID, how it's affected all of our daily lives in certain different ways. So Nami, actually, this is a good point to start this dialogue with mental illness and bringing it to the forefront to actually make it a household name. One thing that we try to stress is we want to try to break the stigma around mental illness as well. And doing forums like this, I think that can actually be established, that if you go and educate, and like I said, it's not something that has hit everyone in their lifetime, but when it hits yours or a friend or your coworkers, and you know about their services out there, please tell them about it. And please just make sure that we're trying to reach out to all of Ventura County and just provide the services that we do at NAMI. And we're trying to make a change and doing more to get our state and local, as well as our federal governmental entities, to really make mental health and awareness top agenda priority for them. So again, I want to thank you for inviting us out today.
Thank you, Roberta. Let's welcome Simi Valley's Free Clinics Executive Director, Fred Brauermaster, and the Director of Counseling Services, Marianne Lovegren.
Great. Thank you for having us. Thanks to the City of Simi Valley and Supervisor Huber's office for the invitation. And we're excited to be here to share, and we'll try to make it brief and entertaining as possible. We're with the Free Clinic of Simi Valley. We provide medical services, dental services, legal services, and family counseling services. Let's see if I can make this work. There. We're located in our new multi-services center at 2003 Royal Avenue, which, by the way, back in the 70s was the home of the Ventura County Mental Health offices. And today we're going to focus on the mental health program of the Free Clinic of Simi Valley. We were founded in 1971, which makes us probably one of the oldest providers of mental health services in Ventura County, I suspect. And from 1971 to the present, we offer our services through the generosity of volunteers. All in all, there's about 160 volunteers, which includes the physicians and dentists and nurses that all provide the services. And there's about a dozen professional marriage and family counselors that supervise 8 associates or trainees that provide services. And that, like I said, goes back to 1971, when the first 3 came from San Fernando Valley State College, now known as the California State University at Northridge. We're valued as a training partner by a number of universities around, including Pepperdine University, Cal State Northridge, California Lutheran University, Alliance University, and Townsend University. All of our students come from those organizations. All of this under the director of Marianne Lovegren, who's our Director of Counseling Services. And we're delighted to have Marianne on the call, and she'll chat with us in just a minute about the kinds of services. So Marianne, why don't you tell us?
Hi, thank you again for having us. So the clinic here, we serve all populations. We work with kids, adolescents, adults, seniors, couples, and families. We work with depression and anxiety, relational communication issues and training. We service child-parent relationships. We have 2 amazing play therapy rooms, which Fred went ahead and put on the slide. So we'll be able to share that with you, as well as we have someone that has specialized training to provide them with the play therapy supervision, which is so needed. We find that we have a lot of kids, that come through. We also work with trauma recovery and various life transitions. I think it's important to know that we do not have crisis services, so we do lean on other counties, the facilities to provide that. Also, I just wanted to touch, we were all on telehealth, and we have transitioned pretty much, I would say 80% back face-to-face. Hopefully we will continue that transition because of the services that we provide. I think the benefit of being face-to-face, as long as we can be safe, is definitely there. So.
Here's where we can show two of our play therapy rooms where we work with mainly children that have been victims of trauma. In the picture on the left, you can see an observation window where families or other supervisors can be in the observation room watching the kids in session for part of the training. And then these are two of our rooms for adults. We have a total of 7 rooms, and we have one outside area where we can provide confidential counseling for those folks that are not comfortable being inside under COVID restrictions. One of the things is that in our new facility, we're making space available to a number of other nonprofit organizations that provide some kind of mental health services. Among those are Soaring Spirits International, which provides services to folks that have been lost a loved one and are now widowed and dealing with all that. Coalition for Family Harmony, that, as you all know, works with women that have been sexually abused. Sarah's House is a maternity home for unwed mothers, and they have an office in our building. And Gigi's Playhouse works with the folks, young people that that have Down syndrome. And of course, Big Brothers Big Sisters, as was mentioned earlier by Dr. Johnson, I believe is one of our partner organizations, and they have after school programs here mentoring young people in high school and schoolwork and stuff. That's who we are, and we thank you again for this opportunity. And I put a slide up here that shows our phone number at 805-522-3733. And please you're welcome to visit our website at freeclinicsv.com. And just 2 things in closing. One is that in 2020, we had the honor of being named Nonprofit of the Year in California. And so we're very proud of that. And a little shout out to Michael Rodriguez, who's on this call, who is our former board president. So, hey, Michael. So thank you very much.
Thank you.
Thank you, Fred and Marianne. I'd like to introduce Lucrecia Campos Juarez, who's the Director of Mental Health Services for Clinicas del Camino Real. Kelly, would you please pull up her presentation?
I surely will.
Thank you so much.
Well, first of all, thank you for inviting us to share some information about mental health. And I think it's great that Simi is taking an innovative approach to provide this type of informational sessions. Kelly, would I share my screen?
Can you not see the screen?
Yeah, we cannot see it, Kelly.
Let me see if I could pull it.
Oh, it should be right here.
Here we go.
Okay. Are you able to see it now?
There we go.
Yes.
Okay. Well, just a little bit about Clinicas. I think like with the Simi Valley Free Clinic, we're celebrating our 50-year anniversary. And we're a federally qualified health center, and we provide comprehensive medical services. And when I say comprehensive healthcare services, it includes primary healthcare services. And within primary healthcare, a lot of the specialty medical services. We provide dental care, vision care, mental health services, health education. We have a pharmacy that serves all of our sites. We have an outreach team and enrollment specialist. And in addition to that, something that I didn't put here is that we have mobile units. We have 2 medical mobile units and also a dental mobile unit that we use to outreach more the community or where the clients can come to us. We do special events to go out and serve them. One of the things that I have learned and really appreciated coming to Clinicas, especially when we talk about mental health services, is that providing comprehensive health care in the same facility greatly reduces the stigma of mental health services. Because by doing that, a lot of the clients who have those concerns, they don't have the stigma of going to a facility that has this big announcement, mental health services. As we're known in the community as Clinicas, they usually say, I'm going to Clinicas. And, people don't know if they're coming for medical care, for dental, vision, or mental health. So that's one of the things that I have seen that really reduces the stigma associated with mental health services. And then the other advantage is that we really could provide an integrative model that our medical providers don't have to worry about where they're going to refer patients that need mental health care services, because we're just down the hallway. And I believe that, the clients also feel more, it increases the trust that they don't have to go to a different facility to look for the services. And we share the same medical health record system, so it's easier to coordinate those services. So in terms of our hours of operation, we have Mondays and Thursday, we have what we call late shift, that our sites are open from 9 o'clock in the evening to 8 o'clock in the, from 9 o'clock in the morning, to 8 o'clock in the evening, to provide increased access for those clients that cannot take time off during the day. And we provide evening appointments. And then in some sites, not on all of our sites, we also have Saturday hours from 9 to 2 o'clock. And I have also listed our after hours care, where we have 24-hour answering services for all of our providers. So it's not only for mental health on-call provider, for also medical and dental. In terms of, how people pay for our services, we have a great options to cover the services. We accept numerous private insurances. We take Medi-Cal, Gold Coast, and now is Beacon, Medicare. We have a sliding fee scale for those patients who do not have any other resources and they don't have any insurance. We have payment plans. One of the things that also we try to serve in the whole Ventura community is that we have 16 locations. And one of the reasons I wanted to list all the 16 locations, even knowing that we're focusing on services to Simi, is because this is also convenience for many Simi residents, that if they work in another city in the county, they could make their appointments in any of our 16 locations. And that again, it opens up more convenience, that they don't have to, let's say, for example, if they work in Oxnard, they don't have to drive back to see me for their appointment. They have their appointment in Oxnard, and then go back to work. And again, because our flexibility of having the electronic health records, all the providers have access to the records regardless of the location that the client is being seen. But in Simi, we have 2 locations. It's Simi Valley, Madera, and in Simi Valley. And I have included the information for those 2 sites in Simi. And when we talk about the specific mental health services at our location, we provide outpatient services. We provide also psychiatric services. We have psychiatric providers. And our services are more geared to Clinicas patients. And so we do that is that it makes it easier to provide the integrative healthcare approach. And it's easier to coordinate with the medical providers or sometimes with the dental provider or the optometry providers when we provide the whole comprehensive healthcare packet. And in terms of the ages that we provide, we start providing services from school-age kids, sometimes as young as 4 or 5, to teens, young adults, adults, and senior citizens. I also provide some clinical services, and I could tell you that my youngest client has been 4 years old, and my oldest client has been 93. So everything in between. We recently also started providing more mental health case management services to assist our clients who need more connections to other community resources like housing, legal services, food share, and other community resources. You know, our kind of target population is the mild to moderate clients that, you know, that have those type of mental health needs. We coordinate with other community resources, like I said, and when we identify a client that might have moderate to severe mental health needs, that's when we transfer that to Ventura County Behavioral Health, or when we identify someone that might need more extensive drug and alcohol services, we also help with that transition. All of our services are provided in a cultural competence manner, and we have bilingual providers to meet the needs of our diverse community. So that's a little bit of who we are. And I'm open to questions. Thank you.
Well, thank you, Lucrecia. Okay, and without further delay, I'm going to welcome the District Attorney from the County of Ventura, Erik Nasarento. Please go ahead, and thank you for your patience, Erik.
Oh, my pleasure. It's been a great afternoon. A lot of connections, a lot of great information has been shared between us and the public. My thanks to you, Assistant City Manager Swan, Mayor Pro Tem Kavanaugh, and also to our Supervisor, Bob Huber, for your ongoing leadership in the mental health field. For those of you who don't know, Supervisor Huber and his colleagues appropriated additional positions for mental health prosecutors in my office. I'm very grateful for that, Bob, and also for your ongoing funding of Hillmont to deliver more inpatient psychiatric beds at that facility. I want to talk just briefly about one area of collaborative courts, and we call them collaborative courts. Dr. Savette Johnson touched upon them briefly because they are true collaborations between the Ventura County Superior Court, the Office of the Public Defender, in some cases the Veterans Administration, Ventura County Behavioral Health, as well as the Probation Department, and of course, the Office of the District Attorney. One of those collaborative courts is relatively new. It has taken hold in the last couple of years, and it is known as the Mental Health Diversion Court. And I want to just walk through what that means and some of the individuals who may be eligible for it. Basically, collaborative courts seek to use the overarching judiciary system to incentivize treatment, rehabilitation, and change in lieu of incarceration. Why is that important? Because we all have a common and shared goal of reducing recidivism and not incarcerating those who need psychiatric help, intervention, and support. So 3 years ago, mental health diversion takes foot. And in order for someone to be diverted, that is, to have their criminal proceedings suspended or held in abeyance, the defense counsel, in many cases the public defender, will submit an application to the court. And the court will look at a number of factors. Most significantly, the individual who is seeking mental health diversion must have a qualifying diagnostic statistic manual mental disorder. For example, post-traumatic stress disorder, psychoaffective disorder, schizophrenia, or bipolarity. It's worth noting that antisocial personality disorder and borderline personality disorder will not qualify under the statute. Thereafter, the judge needs to be convinced that the mental disorder played a significant role or factor in the commission of the crime. The judge also needs to be convinced that this individual who's petitioning the court for mental health treatment is indeed someone who would respond to it. That is, the court will need to make a finding that there is a treatment plan that is set forward and that this individual is amenable and suitable for that treatment program. Also, the prospective individual who may benefit from mental health diversion has to agree to be diverted and also to waive or suspend what are commonly known as their speedy trial rights. And then finally, the court needs to make a finding that placing this person on diversion will not pose an unreasonable public safety risk or danger to the community. Now, I mention this because there have been successful cases in which the collaboration has taken root and has been successful in diverting and helping others. And let me just share with you a couple statistics to make that point better known. So since this law took effect a couple of years ago, there have been 104 cases wherein the court has agreed to mental health diversion. And typically when an individual is diverted, Dr. Savette Johnson and the Ventura County Behavioral Health play a prominent and very important role. The individual may seek outpatient services through one of her outpatient clinics. Dr. Michael Rodriguez will often opine whether or not they are suitable. And it's a true collaboration between your county and the offices that I identified earlier. So since that law took effect, 104 individuals have been granted diversion. 57 are still in the program. It's worth noting that this program is eligible for both felony and misdemeanor offenses, and it can be upward to 2 years. Now, it's worth noting that not all offenses and offenders will qualify, but nevertheless, this is an alternative sentence to incarceration and punishment that obviously places a premium on treatment, rehabilitation, and intervention. So I mentioned that 57 are still in the program. I'm proud to share with the viewing public as well as all of you that 29 have successfully completed diversion. Now, what does that mean? What that means is they suffer no conviction. And indeed, their arrest record is sealed. And they are able, because they have gone before the court, shown that they were able to complete their treatment plan, met the periodic progress reports before the court, they have demonstrated that the case should be entirely dismissed and therefore they should suffer no conviction. There have been 12 individuals among those 104 who have not been successful, which essentially means criminal proceedings have been reinstated. So I know we're short in time. I want to allow everyone to ask questions of the panelists, but I just want to give my thanks specifically to Dr. Savette Johnson, public defenders, Claudia Batista and Michael Rodriguez, Mr. Varela with our probation department and the Veterans Administration, and obviously our mental health judge, Judge Nancy Ayers, for continuing to balance the needs of the public and public safety while also looking for cases in which someone is suitable and qualifies under the law for mental health diversion. Again, to the city of Simi Valley and Supervisor Huber, thank you very much for the opportunity.
Okay, thank you, panelists. Let's open our Q&A session. Kelly, I think we have a question here.
We do. We have a question from our council member, Elaine Litster. It is specifically for Dr. Johnson. In one of your slides, the base of your pyramid states that in 2020, 279,949 were served with substance abuse disorder prevention. Are you stating that over 1/4 of our county in 2020 reached out to you with substance abuse concerns? And how have these numbers been served?
Thank you for the question. So the slide refers to the fiscal year 2019 to 2020. So we start July 1, 2019 through June 30th, 2020. And that the base of the pyramid is prevention, education, and outreach. So what that means, and we have to keep counts because we have a contract with the state for prevention services, so we have to report everything to them. And so that means that we've either done workshops, presentations, we've provided information sessions, and we count. We have sign-in sheets, and we document how many people we interact with at each of those events. And so, yes, it means that in some way, some forum, maybe we were at a conference and we did a session and maybe there were 300 people there, right? And so that would count because we have the enrollment from that session, we have the materials that we presented in the presentation that was done, and that goes in our logs. So we do count everything that we do because we do have to report all of this to the state, either through our state contracts or through Mental Health Services Act prevention. But yes, that's what that means. But doesn't mean that they enrolled in our services. That's just universal prevention, education, and information. So it means that there was some forum that we provided information about substance use services prevention.
Great. Are there any more questions, Kelly?
As of now, I have no other questions in the Q&A chat box.
Okay. Are there any questions that the panelists would like to ask one another before I close the forum? Or are we good? Okay. All right. Well, this will conclude the city's mental health forum. The recording of this forum will be placed on the city website for everyone to view. We have created a mental health resource page on the city's website. We'll go ahead and update it with some of the information we've obtained here from the webinar. In addition, our council has asked us to distribute a resource document to all of our nonprofits, faith-based organizations, and partner agencies, and we'll be doing that within the next month. I'd really like to thank all of the panelists for the excellent presentations and all of the contribution each and every one of you make in providing mental health services to our community members. Again, a very sincere thank you. And with that, everyone have a great afternoon. Thank you so very much.